Hello, my name's Holly and this is my EDS story. I have classical Ehlers-Danlos syndrome, type 2, can't remember exactly which way around it goes. I have the hypermobile symptoms as well, so I have very soft skin, very stretchy, and I'm very, very bendy. All started for me when I was about 16. I had hip pain, but I was playing a lot of sports, so every doctor that I saw would just pass me off as growing pains, too much exercise, too young, too much running, too much high contact, sort of high impact sports. So I was given some ibuprofen and sent on my way. This happened for around 3 to 4 years until I was at university, so I was forced to change doctors as I'd moved across the country. I went to my GP and they actually got me to walk in front of them for the first time. By this point I was having trouble in not only my right hip but also my left, and I thought that maybe it was because I was overcompensating. If I was limping on my right hip, then my left hip would start hurting, and I thought that it was because I was putting my weight on my left hip more, so that's why it was doing it. So did they, except for my new doctor. So my new doctor got me to walk in front of her, sent me off for tests. I had MRIs, X-rays, the lot. Still couldn't find out what was wrong. And then I was playing hockey, injured my left shoulder, and it kept popping in and out all the time. I was having loads of pain, and after my GP had looked at me, she decided that whatever was happening with my hips was also happening with my shoulder. So she referred me to another GP in the practice who was a joint specialist, and I sat down in the room. I'll always remember it the rest of my life. My appointment was just before 11. I was rushing because I hadn't had breakfast because I was a poor student, and walked into the room, sat down, and my shoulder clicked very loudly, and within 2 minutes he knew exactly what was wrong. So he tested my flexibility. We did the Baton test, the Brighton criteria, all the tests that I'm sure that you are now very familiar with if you have EDS and you're watching this video. We did all the tests, sort of worked out exactly what was going on, and he sat me down and said, right, you are hypermobile. No more high impact sports, no more running around and just doing whatever you feel like, because at that point I was chugging prescription painkillers like no tomorrow just to get through every day. I'd wake up and not be able to get out of bed for 6 hours and not know why, and all of a sudden I had my answer. So on one part of me was very relieved that I finally knew what was happening with my body, but on the other side I'd played competitive hockey since I was 6 years old, and I was studying to be a police officer because I wanted to be out there on the streets. I wanted to make a difference, and all of a sudden I had all of that taken away from me in one morning. So I had to make the decision of whether to let this defeat me or whether to work at it, to try hard and to get around it, because you can either fight or you can give up, and I'm not the kind of person to give up. So that day I had gone to see a careers counsellor. I'd changed my degree course and I managed to start on the chemistry course that year. So restarted university in the September, and I started having problems with my hands. So I'd only had hip problems and shoulder problems, and now it was my hands and my jaw and my feet and my knees, my toes, my wrists, my elbows. It all started going at that point. So it was a difficult time. It was difficult, but in the end I ended up leaving university without a degree. My mum had some health problems. I decided to move home and just get my head around things before I worked out where I was going to go. And yeah, that was when I first sort of started to work out where I was in life. I was actually diagnosed, that day when I saw the doctor was 5 days before my 21st birthday, and the day my life turned upside down. I'm now 27. Life is difficult for me at times, but 90% of the time I get on with it. The other 10% I sit on my sofa with a cup of tea and try not to cry. But you know, the hardest part for me is that I can't do a lot of the things I used to. Now, it's been 6 years since that day, and I am working hard every day, and people don't realise that the achiness and the tiredness they get when they have the flu, that's a good day for me. And I work between 45 and 60 hours a week. My employers are incredibly supportive. I get a 15-minute sit-down break every 4 hours, whether I need it or not. I'm told I have to go and sit down and rest. I'm given admin shifts when I need them, and you know, they've just gone out of their way to be incredibly supportive, and that's just amazing. It's one of the biggest reasons I can still cope, that my life hasn't changed in that area. I've also got an amazing boyfriend who I live with, and I'll get home from work and I sit down and I can't move. I can't get up and cook the tea. I can't do any housework if I've been doing anything else that day. And he'll come in, make me put my feet up so he can get the hoover around, and I'll get a cup of tea. I get to sit down and watch a film, and he'll look after me, and it's brilliant. I think what I miss the most is my independence. So if my boyfriend were to go away for a week, I wouldn't eat well. I wouldn't be able to take the bins out. I wouldn't be able to wash myself properly if I'm having a bad day. I'll struggle to dress myself at times. I struggle with buttons, especially small buttons. My work uniform has very small buttons, which can be quite frustrating. I have actually had to go into work with a vest top on, with my shirt over the top, and had to ask someone to button me up before when he's been working late. But generally, I have a very, very good life. I'm a very, very happy person. And I think having EDS and going through what I have and what I do, it made me so much stronger. It made me so much more accepting and more patient, and I was incredibly impatient and not very accepting and quite selfish. And I think now I don't take anything for granted anymore. I don't before I was like, if I felt my jeans were getting tight, I could just go for an extra run a week, go for 5 runs instead of 3 runs, or I could go to training for a bit longer, or I could just go for an extra walk. And now I can't. And when you have people who come to you and they're just like, oh, I wish this would happen, or I wish this would happen, or I don't like this, I don't like that, and I'm just want to shake them and say, do something about it. You can do something about it. You're so lucky that you're in a physical state where you can do these things. And it's hard. It's almost painful to watch sometimes, knowing that they are so lucky and they don't know. But I only know because of this, because of my EDS, and I wouldn't be the person that I am today if I didn't have it. And I quite like who I am today. So I don't know whether, if I'd had the choice whether to have it or not, well, I definitely wouldn't have it. Actually. Okay, I think I've got a few bits of advice for people. Obviously, I've had this for 6 years now, and you know, there's going to be more and more people every day are finding out about this life-changing condition and how it can affect them. So my 3 biggest tips, absolutely biggest tips. Number 1, talk to people. Talk to your family. Talk to your friends. Tell them about it. Tell them how you feel. Don't be that person who whinges all the time, though. That's quite irritating. I learned that quite early on. Because if you're always in pain and you moan every time you're in pain, people are not going to want to talk to you. But if you're having a bad day, don't be afraid to tell people. Don't be afraid to set those expectations with people. When I was at work, I thought that I'd have to keep it a secret and not to tell anyone, that I had to be strong and go through this on my own. But I don't. You don't have to be on your own. My parents and my brothers and my friends they are the reason that I can still smile. They are the people who look after me when I'm having a bad day. When I'm at work, I've got people who physically take things off me and make me go and sit down because they can see in my face that I'm in pain. I don't have to say a word, but they can see it and they know. So please, please talk to people. And if you don't have anyone you can talk to about this, then the Hypermobility Syndrome Association are absolutely fantastic. There are so many resources out there. There are people on Facebook, numerous names of people that you see on these Facebook groups. If you message them, they will talk to you. They don't mind, they've been through it. Always talk to someone. Okay, number 2, know your body and know your limits. It will take time. I injured myself even more because even after I'd found out about having EDS, because I didn't know my limits and I didn't know what I could do and what I couldn't do. And you need to learn your limits and you need to stick to them, because I'm sure, as most of you are aware, there's the spoons rule, where you only have a limited amount of energy that you can give up every day. And if you use up too much energy one day, it will affect you the next day. So even if you're having a good day and you think, do you know what, I could run around this corner, or I can lift this big piece of furniture, and then the next day you wake up and you can't move your arm. And I've been there too many times. So take my advice, know your body, learn your limits and stick to them. Then my third, final piece of advice, never ever lose hope. There is always hope. You can be in the most pain imaginable, but it will pass. And you can go to your doctor, you can get support there, you can have support from the EDS foundations, like the HMSA, all of these things. You can always talk to someone, you can always get extra help. There is always help available out there for people who ask for it. And don't be that person who sits and suffers in silence on their own, because it's not a nice place to be. I think that's about it. 12 minutes, I think I better wrap this up now. Thank you very much for watching, thank you very much for listening. I hope this has informed you a little bit more about EDS if you didn't know, or even if you did, this is my story. So thank you very much for listening.